All right, welcome back. Today, we're jumping into the grand finale of pregnancy, the third trimester. This is it, the home stretch. It's the final lap where everything kicks into high gear. From week 28 all the way to delivery, we're not just telling one story here. We're actually following two incredible parallel journeys that are completely intertwined. So, what really goes on in this final countdown? Let's pull back the curtain on both of these incredible transformations, starting with the one happening deep inside the womb. First up, the baby's world. And what's happening in there is honestly nothing short of miraculous. Think of it as the ultimate intensive prep course for life on the outside. So, at the very start of this trimester, around week 28, the baby weighs about 1 kilogram or roughly 2.2 pounds, which is already amazing. But believe me, the biggest growth spurt is just getting started. By the time they're ready to be born, that weight will have more than tripled. Can you believe that? Most of that rapid gain is from a layer of fat that gives newborns that adorable, chubby look and, more importantly, helps them regulate their body temperature once they're out in the world. Okay, and this is where it gets really cool. We're talking about the final system upgrades. The lungs start making something called surfactant, which is this incredible substance that's absolutely essential for that very first breath. The brain is developing so fast that the baby actually has sleep cycles and might even be dreaming. Their skin gets this waxy, protective coating. And get this, their senses are coming online. They can hear your voice, and they can even react to bright light from outside. The world is already starting to filter in. And then comes the big move. Near the end of the trimester, most babies will do this little flip into a head-down position, getting settled deep into the pelvis. This is called lightening, and for a good reason. It can literally relieve pressure on the mother's diaphragm, making it just a little bit easier to breathe. So, while all of that is happening inside, the mother's body is going through its own incredible metamorphosis. Let's flip the script and look at the other side of this journey, the amazing changes happening on the outside. What's so wild here is that all those common discomforts, they're actually direct proof that your body is doing its job perfectly. That shortness of breath you feel, well, that's just your amazing uterus pushing upwards to make more room. Every single symptom is really a sign that your body is adapting exactly as it should. And your body's support systems? Oh, they are working overtime. Your heart is literally pumping more blood to feed the placenta. You might start feeling what are called Braxton Hicks contractions. Think of them as the uterus doing little practice runs for the main event. And your body even starts making colostrum, that super nutrient-rich first milk. It's all happening. But it's not just physical. The mental and emotional shift is just as huge. So many parents-to-be talk about this nesting instinct, this sudden, powerful urge to clean and organize and get everything just right. It's this beautiful, primal energy, a mix of excitement and, yeah, maybe a little bit of healthy anxiety too. Okay, so knowing what's happening is one thing, but what's the actual game plan? This next part is all about the practical, actionable playbook for navigating these final months. First things first, your checkups. You're going to notice that your prenatal visits get a lot more frequent now, and that's because your doctor wants to keep a really close eye on both of you, checking things like blood pressure, the baby's heart rate, and their position as you get closer and closer to your due date. Of course, all this rapid growth needs fuel. We're talking about an extra 450 calories a day. Iron becomes super important to build the baby's blood supply and prevent anemia. Calcium is a must for all those developing bones. And protein? Well, that's the basic building block for, well, everything. And here's some simple advice that makes a huge difference. Gentle movement like walking is fantastic. When you're sleeping, try to lie on your left side. It actually improves blood flow to the placenta. Drink lots and lots of water. And, of course, getting that hospital bag packed and ready to go, that brings such an amazing peace of mind. Okay, this brings us to a really crucial part of the journey, learning how to read your body's signals. It's all about knowing the difference between normal signs of preparation and the signs that mean you need to call your doctor. Right, and this next bit is incredibly important, so let's be super clear. When we talk about warning signs, these are the non-negotiables. These are not things you wait and see on. These are signals from your body that mean you need to get in touch with your doctor or hospital right away. This slide is absolutely critical. Things like vaginal bleeding, a really severe headache, or noticing a big decrease in your baby's movements. Any of the signs you see listed here, they all mean it's time to make a call or head to the hospital immediately. Please don't hesitate. Now, on a much more positive and exciting note, Your body also gives you some pretty clear signs that labor is getting close. You might experience that lightning we talked about earlier. And your contractions, they'll go from being those irregular practice runs to a very clear, intensifying pattern. They'll get stronger, last longer, and come closer together. That's the pattern. That's your cue. That's your body telling you it's go time. So after 9 months of this incredible dual transformation, what does being prepared really even mean? Maybe it's less about having the perfect plan and more about trusting the amazing wisdom your body has shown all along. It's about being ready to close this chapter and finally, say hello to the person whose journey you've been a part of from the very beginning.